Today I'd like to talk to you about high blood cholesterol and the nutrition therapy for lowering high blood cholesterol. Cholesterol is in fact a fatty, waxy substance that's very essential for our body. It has many roles in our body. It makes hormones like sex hormones, testosterone and estrogen. Also, it makes the cell membranes and certain vitamins, especially vitamin D. So it is critical for our body to make cholesterol. So most of the cholesterol that we have in our blood is made in our liver, but some of it comes from the food we eat. Then if cholesterol is so good for us, why a high blood cholesterol is so risky for us? When you have a high blood cholesterol, doctors always warn you because it can increase the risk of cardiovascular diseases, heart disease, heart attack, and stroke. And the reason is that the high blood cholesterol can cause plaques in the arteries, and when basically plaques burst and no blood or oxygen gets into your cells, then the cells can die. If the cells of your heart don't get the blood and the oxygen, then they die, and then you experience heart attack, and the same can happen to brain, and you can experience stroke. So that's why when the blood cholesterol is very high, especially when they look at your LDL cholesterol and they see a value of over 190, they recommend medication, and that medication is important for you to lower the risk. Heart attacks, strokes, we're talking about actually life and death risk. So that's why it is important to take medication when the LDL cholesterol especially is high. LDL cholesterol is responsible for that. HDL cholesterol is a good cholesterol which takes the cholesterol to your liver, and then the liver can take care of it and get rid of it. But the LDL cholesterol is the one that can cause deposits on the arteries and make plaques or clogs the arteries. Now I have three recommendations for you to lower your blood cholesterol. One is increasing the fiber in your diet, especially soluble fiber. Fiber is in whole grains, fruits and vegetables, usually about up to 30 grams of fiber per day, especially 10 grams in the form of soluble fiber, can help your gut not to absorb the cholesterol or bile acids or bile salts, and basically your blood cholesterol gets lower. Second, I like you to avoid saturated fat in animal proteins, especially meats and dairy. You should consume lean proteins, and especially I want you, go for vegetable proteins like tofu or legumes or nuts. Those are better proteins for you in terms of lowering your blood cholesterol. And also consume the low-fat dairy in your diet. This is the second recommendation. The third recommendation is lowering the sweets in your diet. Sweets like baked goods, they are high in butter or hydrogenated fat and sugar. Sugar by itself can block the enzyme that can break triglyceride in your blood, and we know that when the triglyceride is high also it contributes to the blood cholesterol. So it is important to eat more of the fiber and less of the saturated fat and sugar and refined carbohydrates in your diet. In addition, exercise and weight loss can really help you to lower your blood cholesterol. I hope this information helps you to make better decisions when your blood cholesterol is high. Take care.